Root canal therapy is a type of dental treatment utilized to treat infections and disorders that affect the pulp area of the tooth. Many times, patients do not recognize they require a canal until they begin experiencing extreme discomfort or pain. The video below will examine the symptoms that may indicate the need for the aid of a root canal. 1. Persistent pain. One of the most commonly reported symptoms that indicate you need an emergency root canal is the persistent discomfort or pain that a tooth. It can be minor to intense and can become more severe when you bit to the damaged tooth. The discomfort could remain constant, or it may appear with a whimper. However, should it last for a prolonged period, the possibility is that it's an indication that the pulp inside the tooth is contaminated and must be addressed through an endodontic canal. 2. Sensitivity to hot and cold. If you are experiencing sensitivity to hot or cold food or drinks, and it persists even once the stimulus has been taken away, it could be an indication that the pulp in the tooth is either inflamed or is infected. It is usually due to the blood vessels and nerve in the tooth getting damaged. In this case, a root canal could be needed for relief from discomfort. 3. Swollen gums. Swelling and inflammation of gums surrounding teeth can be an indication of an infection which has gotten to the roots of the tooth. The result is discomfort, redness, and swelling in the location, and could occur with an appearance of a pimple or bump around the gums. If you are experiencing these symptoms and are concerned, you must consult your dentist as fast as possible in order to assess the need for a root canal. Necessary. 4. Discoloration of the tooth. Teeth that are discolored can mean that the pulp inside the tooth is either infected or is damaged. The tooth might appear lighter than surrounding teeth, or appear black or gray. Color. This coloration may be the result of a breakdown in dental tissue and could indicate of a need to have a root canal. May be essential to save the tooth. 5. Prolonged sensitivity to pressure. If you are feeling sensitive to pressure while chewing on a tooth, this is a sign the tooth's pulp is damaged or infected. It can happen when eating or chewing. It may be the result of the pressure, which causes irritation of the nerves in the tooth. If the discomfort is not gone or becomes worse with time, it could be a sign it is time to get a root canal might be necessary. 6. Cracked or chipped tooth. A chipped or damaged tooth may expose the pulp of the tooth to infections and bacteria necessitating root canal. If you've suffered a broken tooth, you must visit your dentist to get assessment to determine if it is needed to have a root canal in order to preserve the tooth and to avoid any further issues. When you're suffering from any of the indications discussed above, it's imperative to consult your dentist for an assessment to decide if you're in need of the procedure of a root canal. A root canal can help protect a damaged or infected tooth as well as ease discomfort and pain. This allows patients to preserve their dental health and avoid costly treatment for dental issues in the future. Keep in mind that the earlier detection and treatment are vital to ensure the overall oral health and gums. So don't disregard any symptoms that might be a sign that you're in need of the aid of a root canal.